1,200 cc's of fat was injected into my butt my first surgery. My second, it was about 900 cc's.
My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. On this video, we are going to watch and react to an episode of BOTCHED. And this one is about BBL, the most dangerous cosmetic surgery being performed today, otherwise known as booty enhancement. Let's watch.
You know, it's all about the booty. Make it big, really poke it out.
I carry every ounce of fat from my body in my butt. When I first started working at the steel mill, it was amazeballs. Being the only female able to do what I did, it brought me up to transforming myself into this superhero type person. I weighed 310 pounds. I saved up and decided that I wanted to have some liposuction. I wanted to use my fat and not throw it away. 1,200 cc's of fat was injected into my butt my first surgery. My second, it was about 900 cc's.
First thing before we get into the butt is that she lost a lot of weight, and so kudos to her. It is not easy to lose weight, and for her to do that and then to feel great about her body is absolutely awesome. Well, now let's talk about her behind, her butt. She had 1,200 cc's injected into each butt cheek in her first surgery. That is a lot of fat. You know what a 2 liter of soda pop is, so you take about 1,200 cc's of that 2,000 cc's, so it's a good amount in each butt cheek. But it's not absolutely unusual. But the fact that she went back and had another 900 cc's injected, now we're getting into massive territory here. Now, back when I used to do buttock enhancement surgery, I would put in anywhere from about 300 to 600 cc's. I no longer perform that operation, though, because of the potential risks, and we'll talk about that shortly.
Superwoman, she stops traffic, baby. But I'm unhappy with the shape of my butt.
When you look at her, you can see this almost impossibly thin waist with this large behind. And that's the type of shape that you see in people who've had a lot of plastic surgery to reshape their body. You may know some celebrities, some singers, some rappers, some actors who have figures similar to this, and most likely they're not realistic either. I do want to commend her, though, in that she's happy. She appears to love her body. These just aren't operations that I would recommend.
It kind of took on a flat surface.
What do you think is the way to correct that?
Got a little bit more fat grafting.
To bring out the flatter
Yeah.
areas. Okay.
Today, you have met Superwoman.
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 What's that?
Super means super.
Oh, I get that,
Okay.
but what is
Like super dumb.
Super booty, not super booty, super booty, super booty.
So now she has 2,100 cc's of fat into her butt, and she wants more injected. A couple of things that I would wonder in this situation. Number one, where's the fat going to come from? I mean, she doesn't appear to have fat hardly anywhere else in the body, and in order to inject it into the butt, you need to have fat to harvest. And number two, this is the most dangerous cosmetic surgery being performed today, BBL. When we take fat from one part of the body and inject it into the butt, the main risk is of a fat embolism. That fat can accidentally be injected into the large veins of the butt, and that can actually go to the lungs and kill somebody like that. And the way to describe it, it's like you're watching Star Wars and those missiles go into the Death Star and the Death Star blows up. This is like the Death Star. If this happens to you, within literally a minute or two, you could be dead from this operation. And that's why you have to be very careful. There are recent studies even that show that the fat doesn't even have to be injected into the blood vessel. It can be injected around that blood vessel. And when you have so much tension in the butt from that fat, the fat can actually go through micro tears of the blood vessel to enter the bloodstream. So you don't even have to inject it accidentally into the blood vessel. It can actually seep through on its own. It is absolutely frightening.
When you fill up a fat compartment, there's arteries, veins, and the fat. These veins are connected to the main veins, which lead to the lung. If fat goes over to the lung, you don't just get a little short of breath, you die. Do not stick any more fat in that buttock.
I sense the genuine.
Oh, yeah. Patricia is listening to us, and we're getting through to her. Enough is enough.
I'm so glad that Dr. Dubrow said enough is enough. As plastic surgeons, it is our job to help patients advocate for themselves. And sometimes patients don't realize the potential risks of operations, or they're willing to undergo an operation even though it could be potentially dangerous. Make sure you research your doctor very, very well, because once again, this is the most dangerous operation, cosmetic operation, being performed today. And if you would like your buttocks slightly larger and lifted, and you want to avoid the risks of surgery like this, then you may want to consider a device like EMSCULPT. EMSCULPT is a device, it's a new device that utilizes electromagnetic energy to stimulate your muscles to contract 20,000 times over a half hour. And this is a natural buttock enhancing, buttock lifting treatment that has very, very, very little risk. At most, you may get some cramping, and that's about it afterwards. So if you're thinking about getting BBL surgery, you're afraid of it now, and you want something that is completely safe, check out EMSCULPT. Well, that was a lot of fun. I'm so glad that Dr. Nassif and Dr. Dubrow convinced this patient not to undergo further surgeries on her buttocks to make them larger. Well, if you think her buttocks were large, check out this video from BOTCHED where I react to a woman who has breast implants that are 4,600 cc's. It is absolutely crazy.